Hi, do you like to share meningococcal meningitis, which currently during the time recording, hot topic in the UK, and this is a spread within the same group of university students, and then which they visit the same club, and then after that, those who have close contact with them also got the meningococcal disease. And this is a very important clue, help you to have identify which pathogen before you get the blood um, culture result, and then you because you can't wait for the result, but you have to decide to give empirical antibiotics. But if you notice the pattern and the group and then the symptoms, you may add some specific antibiotics for that pathogen with empirical antibiotics. Let's discuss about the symptoms of the general symptoms of meningitis. We first have a triad here, which include fever, autometastasis, and serious symptoms of meningitis, which include headache, neck stiffness, and photophobia. So basically, when you see this fever and with neck stiffness, I think this is enough to raise your alert towards meningitis. It's like a relatively common like combination to raise your alert, and then I hope you can remember this specifically. And then there's also the nauseous, vomiting, and then malaise, and then seizures and cutaneous cachexia. Why I mark this in red? Because this is a specific symptoms like points towards the meningococcal meningitis. And what is petechiae? This is a type of non-branching rash, which means when you apply pressure, like you pressing on the rash, the skin is not gonna turn white under the pressure, but still remain red. The rash is still remain there. So this is how it is. It's usually gonna be red or brown rash under the skin. For meningococcal meningitis, this is caused by Neisseria meningitidis. So we have a series of specific symptoms related to this bacteria. For more understanding towards this bacteria, I hope you can remember this is always spread within school or in military, because there's like a bunch of people stay together in close contact and in long time. So like school and military, they are the common location for this to spread out. And these symptoms in these slides, they are common in children, which they show myalgia, which is pain in muscle pain, or petechial or pubic rash, which I mentioned before, or it's rare, but it's not impossible. But it's not impossible. There will be Waterhouse Federation syndrome. What is this? This is basically this is an annual insufficiency due to hemorrhage caused by coagulopathy triggered by the endotoxin. This endotoxin is triggered by the severe infection from the meningitis. And if you look at this mechanism only, you may find this is quite familiar. This is basically a similar pathophysiology of what happened in DIC. Because, like, if you recall what may trigger DIC, a severe infection may also trigger DIC. So you can try to memorize by understanding the mechanism together. So of course, if the patient having this syndrome, they may also show DIC. and also others series of problems. But if you understand there's going to be an annual insufficiency, then this you don't have to memorize this stuff, but like you may already understand what's gonna be. So what physical examinations? I think you heard of it from time to time because they are common signs related to meningitis, and I don't think I have to explain them like in details. There are lots of videos which they have a demonstration of how to perform it, but just bear in mind these two signs. Like even though they are negative, but it doesn't mean there's no meningitis. Please spread this in mind. But if there's positive, this is meningitis. And what you're gonna do for the test is, of course, you have to perform a number puncture to help you for the definite diagnosis. But before you perform this, you always have to bear in mind that to observe, to identify if there's any contraindication in the patient, such as if there's any infection at the point of the puncture, infection of skin at the point of the puncture, or is there's any mass in the brain. So you may order a head CT, and then to identify, and then just bear in mind that always have to exclude any contraindication before you perform lumbar puncture, or else the worst case may cause a cerebral herniations. So yeah, be careful. And then of course we have to order a culture, which after we perform the lumbar puncture, we send the cerebrospinal fluid, and then also we have a blood culture. And if you feel like so, you may also have a swab, have a throat swab, and then send it for a culture. But usually the CSF culture is the most definite diagnosis. And you may look at this complete blood count or full blood count. Usually it's rather normal or increased white blood cell. But in a severe infection, there's gonna be decreased white blood cell because because they're like a strong infection, your body need more warrior, which means white blood cell to fight against the infection. So at the end of the day, the severe infection kind of like use up most of their white blood cells, so there's going to be a decreased count, and also there's going to be a thrombocytopenia, and this is why the patient have petechiae. And then a basic metabolic panel, and then we look at the CRP level. Usually it's going to be increased in any infection. So this is not specific, but also helpful for you to tells you that's infection. And you can also perform a head CT. So for the CSF, the cerebrospinal fluid analysis, in this case, once you draw the fluid out, you can already identify this is a bacteria, because only in bacterial meningitis it's going to be the color is going to be cloudy. And another picture here. And the cell count is going to be elevated cell count, which the leukocyte count is going to be elevate a lot more than those in viral meningitis. And then there's going to be a high opening pressure, there's going to be increased lactate and increased protein, but others increase, but the glucose level decrease in this case, because I think there's one theory explain that because the bacteria, they consume glucose for their proliferation, so there's a decreased level of glucose. But this analysis are easy to identify which is which. So just have to have more practice, and that's it. So, if you look at this chart, this table, which can explain why in the previous slides I said you can take a sample from the throat for the culture, because the Neisseria meningitis is commonly colonized in the human nasopharynx, and then but like before you have the test result, you don't know which pathogen like is responsible for the infection, right? So if you see there's like there's an infection in the throat, it is like reasonable for you to take a sample, to take a swab and send to the lab. So yeah, and then after the cultures can identify this diplodocus, which means you can literally understand by the words cockroach. Cockroach means like a shape like this, round shape like a ball. Die means two, so that's basically two balls sticking together, and that's it. And then what is the antibiotics for this infection? It's a third generation cephalosporin or penicillin G. And not only for those currently have the symptoms or identify the infection, those who have close contact with them also have to receive antibiotics for prevention. So it's rather be Rifampin cephalosporin or cephalosporin. So I'm going to talk about this antibiotics one by one, but just a brief, like simple discussion on it. So we have the third gen. For the third gen cephalosporin is beta lactam antibiotics. So they're not except like and beta lactam antibiotics. You may think about penicillin. So, but this one is like the mechanism is like penicillin, but different from penicillin. They're not susceptible to penicillin, which this one breaks down penicillin. So they have more advantages compared to penicillin. This is how I memorize it. And then this they penetrate. They cannot like go get through blood-brain barrier at all, but except ceftriaxone or cefotaxime. So just remember these two. They're very special. They can passing through, but even though it is known that other third gen they cannot pass through, but when there's information, so the barrier is kind of like being damaged, they can pass through. But this is not the situation we love to see, but just for your information. Anyway, so I think this may not your first time to heard about this antibiotics, ceftriaxone. Yes, you may heard about this. It's also commonly used for gonorrhea infection, and gonorrhea, if you recall, they are also belongs to the family of Neisseria. So this is how you memorize them. It's not only for gonorrhea infection; it's also helpful in meningococcal meningitis. So, and the second one is cephalosporin. This can also penetrate CNS, the blood-brain barrier, and is coverage for most of the gram-negative except Pseudomonas, and also coverage for the most of the gram-positive bacteria except Enterococcus. But still, the first choice for the meningitis in this case is still ceftriaxone. For the Rifampin, the mechanism of this is by inhibiting the bacterial DNA-dependent RNA polymerase, and so that at the end it can inhibit the bacterial protein synthesis and kill the bacteria. And I understand this is quite difficult to memorize the mechanism of this antibiotic, so I suggest you to just understand it's gonna inhibit protein synthesis. And for the clinical applications, the target on the mycobacteria, when you see mycobacteria, you can already think to TB, tuberculosis. Tuberculosis, you may think about, you may recall the famous regimen to treat TB, which is right, RIPE. So why I mention this here, because I hope you can remember, never ever use Rifampin alone, because it's gonna develop a drug resistance quickly if you use them alone. So whenever you see Rifampin, you think, oh, it's combined with other drugs in TB, so better not use them alone. And yeah, that's just how I memorize it. So also for palsy or polyarthritis, or for those people who are under chemotherapy, but during their therapy, they contact children that infected with Haemophilus influenza type B. So the advantages of Rifampin is that I mentioned before, is also for the treatment of TB, but not for it's not like it's a very very special drug, because like this other drug can like isoniazid, they can treat active TB, but in this case, rather than they can also treat semi-dormant TB, which is latent infection. So other drugs they can only treat TB when they are active, but this one Rifampin can even treat them like when they're not active. So it greatly reduce the time for the treatment. It's like let's say like commonly the other drugs they take more time, but this one it takes shorter period, and that's it. And this one we have a good penetration for the wall of biofilm. So you can already think about this prosthetic joint. So when the patient have prosthetic implants, they are susceptible to infection. So Rifampin is a good antibiotics for such infection. So bear this in mind. And this can distribute winding through CSF, and also importantly available for pregnancy. So there's always disadvantages or cons for that. So when the patients come back to you and say they have orange body fluid, they thought they're bleeding, and their sweat turn orange, and their tears like red and orange, and they have a funny color, they have a red orange color of their urine, and they panic, then you just have to check their drug list and just comfort them. It's just a normal phenomenon, and because this is one of the side effects of Rifampin. And I also mentioned it in previous slides. So it developed drug resistance rapidly if they use alone. So I'm not going to repeat again. But last but not least, I always bear in mind, and this is common in many MCQ in the exam, like they give you examples of a patient have let's say TB is on a TB treatment and on a therapy, but then later he got other disease like just let's say he got other problems and currently have to add, let's say, warfarin for this patient, but the iron now is still like 1.1, even though the patient take the morphine. And then the question may ask you what happened. Then if you see the patient have TB, then you will think of this taking Rifampin. Then it's got drug interaction with morphine. So you can think of already, like you can understand them by understanding, or you have to memorize the CYP450 inducer group. And we have a mnemonic here, is sickface.com group, and I've already marked them here, and there's lots of them in the internet. You can go through them and choose the one you think that is easy for you to understand. So inducer what means that when these group of drug encounter a CYP substrate, they are gonna like help the metabolism of that substrate, and so that reduce, in the case I just mentioned before, reduce the effect of fluoroquinolone. And this is what happened. And in this slide, I also include a mnemonic code for you to how to memorize the P450 substrate. So I think that is just, I mean, I agree this is a like difficult thing to memorize. So I suggest you to practice more question or MCQ on this one, that you can like identify them like immediately. There's nothing can do except practice, practice, and practice. There's no shortcut. And then Verquin, so this is funny in different bacteria. Like when it's targeting on a gram-negative bacteria, it's going to bind to the DNA carriers and then impair the DNA replications. When this is in a gram-positive bacteria, it's going to bind to topoisomerase 4 and then impair the DNA separations. But at the end of the day, they're going to cause bacterial pseudo event, which is killing the bacteria. Just a simple, explanation for the mechanism of this antibiotics. But anyway, the important thing is that you have to identify and treat the patients, and then also bear in mind, just prevent is always better than treating because the damage is done. So always suggest the patient, if they don't have the vaccine yet, suggest them to have a MenACWY vaccine. This is protect against the 4 strains of meningococcal bacteria, A, C, W, and Y. And then the indications of prophylaxis is those who have close contact with people within 7 days of symptoms onset. So these are the recommended antibiotics, basically the same for the treatment, just adjust the dosage for them. And this is the end of my share, and thank you very much.